Okay, all right. Welcome to Birth of Kansas City, the Doc is in. I'm Chelsea Craig, and I'm here with Dr. Jeff Remsburg.
How we doing?
Yeah, if you want to just introduce yourself and tell us why you're so awesome, that'd be great.
Well, I'll try to do my best. My name is, like you said, Dr. Remsburg. I've been a chiropractor for about 5.5 years now in the Kansas City area. I started out kind of in chemistry as undergrad, got my master's in chemistry, and decided I didn't want to be in a lab all day, so I was kind of looking at more into healthcare and decided to go with chiropractic. And then while in chiropractic, I was kind of doing a lot more training with rehab, manual therapy, soft tissue, exercise therapy, sports medicine, things like that. And ended up opening a practice with my business partner in Kansas City, like I said, about 5.5 years ago.
Yeah. So chemistry, but what led you chiropractic? What was that moment where the two kind of collided for you?
So I'd always gone to a chiropractor. Actually, my uncle was a chiropractor, and just all throughout the years, whenever I got injured, I would go see one. And then when I was looking to get into something outside of chemistry, I wanted to look into all of healthcare. I kind of felt it felt the best fit with me. I like the idea of going conservative. I like the idea of kind of working with healthy, fit people, as well as getting people out of pain without pushing drugs or surgery or anything like that.
Yeah. And so did you go to school here, or did you go to chiropractic?
So my business partner and I went to Palmer College of Chiropractic in Davenport, Iowa. So we were there, and that's where we met and kind of talked about opening our clinic together, and that's what happened.
Yeah. What brought you to Kansas City?
So I wanted a city. I'm from Iowa, born and raised in Iowa. Go Hawkeyes.
Yeah.
But wanted to be in the Midwest, but a little bit bigger town. So I was kind of looking at Kansas City or Indianapolis, and kind of just talking with my business partner and some different things, just decided on Kansas City would be a better fit.
What do you love about Kansas City?
I still like that it's the Midwest. You still have kind of laid back people, real friendly, real nice, but at the same time there's a lot of things going on in Kansas City. I think it's a very good place for young people, and I think it's getting better all the time. As far as sports, music, festivals, there's a lot to offer in Kansas City.
Yeah, it's that small town feel, but still a big city.
Right.
You're gonna run into people that you know, but it's not too big.
Right. And there's a lot of transplants from Iowa and Nebraska and Midwest people, so.
Yeah. So tell us about the community that you serve. What do you love about the people that you are treating?
So I like the idea that we treat people that are in pain, that they lack something in their life. They can't do an activity, they can't play with their children, they can't run, they can't lift weights because they have pain, some kind of dysfunction. And I just love being able to serve them, get them out of that dysfunction, fixing what caused it in the first place, and get them back to doing what other activities they went to. Sometimes we can push them in different directions as far as what they want to do to even get more healthier. Sometimes we work with nutrition and recommend certain exercise plans and things like that, but more just about getting people out of pain and back to doing what they love to do.
Yeah, so probably some pregnant women are coming to you because tends to have some pain associated with creating a human. So what do you do with the pregnant patients that you see? What do you recommend for them?
So it's kind of the same with every patient. The big question we recommend when they have pain is, the first one is always, if it's something serious going on. It's very rare, but there's always a chance, is that pain being caused by something like cancer or some disease that they don't know about it. So we always have to rule that out first, and like I said, that's far less than 1% of the population. And then the second step is kind of find what is causing the pain. Is it a muscle? Is it a joint? Is it a disc? Something like that. Once we kind of identify that, we can kind of treat that tissue, get that tissue back to normal. And then the third thing is, why did that pain occur in the first place? With pregnant people, a lot of times, obviously their body's going through a big change. We're losing a lot of stability there. So it's trying to add that back in, to kind of have them gain stability, gain a little bit more muscular control, so they can kind of prevent that from, either prevent it from worsening during the pregnancy or get it back to where they were so it doesn't happen again as well. And even afterwards, then get them back to the normal stability levels so they can kind of function, play with their kids without having an increased risk of low back pain or any other kind of pain.
Sure. So it's not one of our pillars, but a lot of what we do is based on DNS. And I know that that's something that you specialize in. Can you tell Kansas City what that is and why it's beneficial, especially for a pregnant woman or postpartum?
Yeah. So DNS is dynamic neuromuscular stabilization. It's basically was kind of developed over in the Czech Republic, the Prague Institute. Basically, it's a way to kind of turn on certain muscles, basically the neuromuscular control of the body. A lot of times, just through bad habits, certain muscles tend to get weak, certain muscles tend to get overused and tight and chronically kind of pain and whatnot. So basically, DNS is kind of a way to stabilize those muscles and kind of get everything back to where it should be. It utilizes exercise, utilizes manipulation, and sometimes it just utilizes some stimulation where we kind of push on different parts of the body and try to get some muscles to activate, to turn on. And then we do always kind of back it up with some more exercises, some take-home exercises that they can do as well. Sometimes it's a little confusing as what we're doing, basically pushing on different spots, activating different muscles, but all in all, it's a very good adjunct to our therapy we do here. And just like pregnant people, just like anybody else in pain, like I said, certain muscles start to shut off. We need to reactivate those muscles, kind of prevent pain in the long term.
Yeah, great. So you probably see just a ton of people all day long. You're treating them, talking to them about taking care of themselves. How do you take care of yourself? How do you practice self-care?
So I've tried to kind of be active all my life. When I was in chiropractic college, I just kind of basically did lifting weights. Once I got out of school, I kind of got bored with that and got into endurance sports. So I got into more running and triathlons and things like that. Again, I kind of got a little bored with that over time. So now I've been doing CrossFit at 2020 CrossFit for about over like 3.5 years now. I actually coach there too a few times a week.
Yeah.
And I just like kind of the good functional fitness kind of variety that CrossFit offers. I think it's always important to find a good gym that stresses, good form, good technique is the main thing for CrossFit, so you can avoid injuries.
Yeah.
So I'm a big believer in CrossFit. It might not, it's not right for everybody. Always got to find something you do love. But I do that, and then as far as nutrition, my wife is very healthy as well. So we're pretty big in, as much as we can, eating organic food, grass-fed food, free-range eggs, things like that. So we follow more of a paleo-type diet, kind of what we do. We don't really eat bread very often at all. Other than that.
Yeah.
Yeah.
And your wife is a new midwife, right?
Right. So my wife has been a midwife at Truman Lakewood for a couple months, but she's actually just switching now. She's going to move over to Research Hospital in Kansas City, Missouri. So
stay tuned for an interview with her.
Yes.
We're working on that one. Let's see. Talked about some of the pillars for birth fit. So fitness, nutrition, chiropractic, and mindset. So we really stress a lot of like mindfulness and connecting with yourself and your baby, even before baby's born. How do you practice mindfulness, and do you meditate? Do you practice yoga, or how do you just take care of that part of yourself as well?
So that's a big thing. That's the thing I need to work on the most probably. I do meditate, but not as often as I should. I was very good for a while, and now I'm just kind of here and there, but it's one thing that I keep meaning in the back of my head to do daily, because I do recommend, it is extremely important. One of the books I recommend to a lot of my patients is 8-minute meditation. Basically, if you have 8 minutes a day, you can meditate and kind of de-stress. We have so many things barking at us all day long to do this, do that, so everybody needs a little bit of time just to de-stress their mind, relax, and take care of themselves. And most of the stresses we can create for ourselves are artificial.
Sure.
You can't change them. They are what they are. So sooner we can realize that and just let it go by us is better.
Yeah, it just allows you to kind of go in and respond versus react, and just listen.
Right. Exactly.
Yeah. I know it's something all of us, even those of us who do meditate on the regular, it's still like it's a practice.
Yeah.
Constant. What advice would you have for a woman who is either thinking about conception, who is pregnant or is postpartum? What would you recommend to them as a chiropractor? How many visits? Why should they come see you, etc.?
It's very individualized. Like I said, we deal with more neuromuscular skeletal stuff. We always kind of say, the earlier you can get in for the low back pain, the better chances you have. If somebody comes into us with 8 months pregnant with terrible back pain, it's going to be hard to, get that better before they have the baby. So basically the first hint of any kind of back pain, things like that, I highly recommend people coming in. like I said, once we identify the tissue that's causing the pain, that kind of changes our treatment plan. Some things we resolve in 1 or 2 visits. Some things may take 6 to 8 weeks. It really just kind of depends on what is the pain generating tissue, and we can adjust that. And like I said, we always will give people home exercises, very simple exercises. It's not a 1 hour home exercise plan. It's 1 or 2 things they can do for a few minutes a day, and that's it.
Sure.
So the treatment plan is always individualized, kind of based on what they have, what kind of pain they're in, and what is the pain generator.
How soon do you recommend somebody postpartum come in and see you?
As far as treatment, we can start pretty early.
Yeah.
I mean, we're not going to go with any vigorous exercises. I mean, I'm sure what you guys say, kind of say 2 weeks, 2 to 4 weeks.
Yeah.
So that's the baseline. So I mean, coming in, we can just check some things out, see what is weak, see how much weakness there is in certain muscles, and we can kind of get a game plan from there. So there's no real hard fast rule about how early. If you're having back pain, anything like that, I'd say come in as soon as you can.
Yeah. Good. What would be 3 pieces of advice that you would give to somebody who is looking to go down a similar career path as you?
3 pieces of advice, okay. I would say, as far as chiropractic goes, the schools teach you the bare minimum.
Sure, yeah.
Yeah, so I think you have to have a mindset that you have to do a lot more outside of class to kind of, be on top of the game. There's a lot of things, a lot of information out there, so you have to do a lot more than, just the bare minimum. Unless you want to be the average chiropractor, and I kind of feel the average chiropractor is, not very beneficial for a lot of people. So you always want to strive to excel. Second one, just learn as much as you can. Have an open mind, try things out, even things that you don't agree with, try them out, see what fits for you, do things like that. And then third, I'd say just learn how to communicate and talk with people.
Yeah.
That's the biggest thing. I mean, you do have to be able to practice, so learn to communicate, learn to talk with people, learn to be engaging, ask people questions. Because a lot of times we want to be the ones talking, but let other people talk for you.
Yeah, that's a good point. What about somebody who's interested in DNS or the training? Like, how can they find that? Is there any in Kansas City, or is it you gotta go to Prague? What's
for people that want training in DNS?
Yeah.
No, you don't have to go to Prague. They have seminar rehabps.com is a website, Rehab Prague School. They list all the seminars. Some of them do come to Kansas City, and it's gaining more and more traction. So they're all over. We were very fortunate because one of our instructors at Palmer College of Chiropractic, the rehab instructor, Dr. Dave Jaring, he was really very, very big into DNS. He has been to Prague and everything, so we were able to learn a lot from him.
Great.
And his references. But yeah, you can learn at different seminars, kind of all over the U.S. and internationally, all over the world, really.
Yeah. We're like, there's somebody in Kansas City though that does it every once in a while, correct?
Yeah. There's different clinics. Like basically anybody can host a seminar. So you go on the website, you can see which ones are coming. Yeah.
Great.
Usually at a chiropractor or a physical therapy clinic. Yeah.
Good. Let's see. Lastly, what would be your best piece of advice for a new mom or a pregnant woman as far as it goes, as far as chiropractic care goes? What would you suggest to them? What would be like that key take home for them?
Key take home, I'd say just listen to your body, and a lot of people say that pain is normal, part of pregnancy. It shouldn't be normal. I mean, obviously the pregnancy, giving birth, conception, or the pregnancy, giving birth part of pregnancy will be possibly painful, but back pain is not normal, carpal tunnel is not normal. Those things can be fixed and addressed the earlier you come in. So I'd say just listen to your body. When things start to feel wrong, get some treatment.
Yeah, we're mixing up common and normal. Just because something's common doesn't mean that it's normal.
Yeah, that's exactly right to put it. Way to put it.
Yeah. Anything else you'd like to share with Kansas City?
I do not. I'd be happy to see anybody that wants to come in, and they can always email us or call us if they have any questions.
Yeah. Tell us where you're located and how we can find you.
So we're at 8839 Row Avenue in Prairie Village. Our website is activehealthkc.com, and people can always give us a call too. Our number is 913-341-1200.
Are you on Facebook or Instagram or any of the social media?
Yeah, we have a Facebook page. We do not have an Instagram page, but you can see our reviews on Google or Facebook. We have pretty good reviews, so if you're hesitant about coming in. And we see a lot of people that have never been to a chiropractor, a lot of people that are afraid.
Yeah.
Some people don't like to be adjusted. We see a lot of people that we never adjust. That's just exercise, manual therapy, things like that too. So we have treatment for any kind of person.
Great. Well, great. Well, thank you so much for your time.
Well, thanks for having me.
That's all for today.
Bye.